Hello, everyone. My name is David Villar, professor of pharmacology, and welcome to this presentation on a topic that has medical experts really worried about because it can threaten the very core of modern medicine and the sustainability of an effective public health response to the threat of infectious diseases. If you think about it, we need antimicrobials not only to cure diseases, but to ensure that procedures like surgeries or chemotherapy can be provided at low risk. And as we will see, the problem lies in that we have been really misusing and overusing antimicrobials in both humans and animals, and we have very few medications to replace them in the pipeline. So, unless we want to head towards a post antibiotic era in which simple infections could once again kill us, we really need to start using them in a more judicious way to ensure that they remain effective for the future. So, I'm going to focus on the consequences of having overused them in food animals, and we can start by saying that some of the clinical implications of having more antimicrobial resistance could start by having more humans in which common illnesses are failing to the common treatments. For example, CDC is constantly warning of emergence strains of salmonella and some other zoonotic foodborne infections that come from animals and are multi-drug resistance because we've been using the same antimicrobials in animals that we need to treat ourselves. Another consequence, or the same goes for increased mortality of some of those more pathogenic salmonella that are multi-drug resistance, and maybe we sometimes rely on empirical treatment to treat some of those infections. When we talk about reduced efficacy of related antibiotics, I guess the classical example could be the use of avoparcin in animals as a growth promoter that was causing resistance to vancomycin, which is a glycopeptide, which is actually one of the last lines of defense against the resistant gram-positive bacteria. Obviously, increased cost of antimicrobial resistance may come from the need of additional treatment, longer hospitalization, more diagnostic tests, and so on. When we talk about increased carriage and dissemination, I'm thinking of these methicillin-resistant Staphylococcus aureus that can be maintained in livestock, and it can actually spread and transmit to humans and vice versa. This is one of those bacteria that you don't really want to acquire if you go to an intensive care unit and you have some type of weakness or frailty. And basically, close to contact with livestock is a risk factor for you to carry these bacteria. And the final point here is facilitated emergence of resistance. That basically refers to the movement of genes of resistance between bacteria. And this is particularly relevant in the GI tract. Appears to be an ideal environment for some of those resistant genes to move from one bacteria to another. So just to show you an example of what I'm talking about here, in 1997, the National Antimicrobial Resistance Monitoring System was launched in the US, and they started looking for the prevalence of resistance amongst Campylobacter in humans. And they concluded that this is a typical example of resistance that comes from the use of antimicrobials in food animals, in this case chickens. If you look at the graph, there was 13% resistance in 97, and it went up to 19% in 2001. And the first fluoroquinolones were approved in poultry in 95. So basically, the conclusion from these surveillance studies, as you can imagine, were that the fluoroquinolones in chickens were compromising the use of this important class of antimicrobials in humans. And because people who seek medical attention are also prescribed these fluoroquinolones, and they were probably not responding as well to the medication. Finally, FDA decided to no longer approve enrofloxacin for chicken, and as you can see, it was withdraw from chickens in 2000. This issue of antimicrobial resistance is something that is really concerning and worries all the major health authorities. As you can see, the three main World Health Organizations have come together and they put together a global action plan in 2015. They're trying to address this challenge of antimicrobial resistance through what they call a global action plan, strategic objectives that are listed here on this slide. The first one is to improve awareness and understanding through effective communication, education, and training. Second one is to strengthen the knowledge and evidence through more surveillance and research. Obviously, they need to know what's going on before they can do anything. The third one is to reduce the incidence of infection through effective sanitation, hygiene, and prevention measures. The fourth one, which is one that we will focus on future videos, is to optimize the use of antimicrobials in humans and animal health. And as I say, ideally, we want to optimize the use not only to achieve maximal clinical efficacy, but nowadays we want to include balancing such efficacy with attaining or not causing or creating antimicrobial resistance in the strain of causing the infection, but also in the patient's or the herd's commensal microbiota. And I know this is not easy to do, but probably there are better ways of using antimicrobials that we've been doing up to this point. And finally, the final point of this global action plan is to develop the economic case for sustainable investment, which takes account of the needs of all the countries and to increase investment in new medicine, diagnostic tools, vaccines, and whatever interventions we can come up with. So as I mentioned in future videos, we will address how to make better use of antimicrobials to prevent resistance. But the first thing that we need to know is what is actually driving or causing most of that resistance, because the concept of implementing an optimal use obviously evolves around knowing what causes it in the first place. And the first thing is to start by reducing the overall volume of antimicrobial use. And this could be done by having a better regulation and oversight of the sales and use, particularly in countries where they can be easily attained over the counter. And there are really no control efforts, and let alone surveillance, particularly in food animals. And the second one, which probably accounts for the greatest use of antimicrobials, which is not therapeutic purposes. It's really for growth promotion, particularly in pigs and poultry. Nowadays, we have these huge factory farming systems throughout the world in which we keep animals confined and we dose them constantly with antimicrobials to keep them disease-free and make them gain weight faster. And if you like to read more on this topic, I'm putting together this guideline recommended by WHO on the overall use of medically important antimicrobials in food producing animals. On this article that came up in 2018, they're basically advocating to completely restrict or discontinue the use of antimicrobials as growth promoters, and not only as growth promoters, but also for disease prevention in healthy animals. And they go even further to recommend that those antimicrobials that are identified as critically important for humans should not be used for food produced in animals to treat any disease unless there are specific susceptibility tests that demonstrate that there is really no other option available to treat that condition. And this is not only WHO that is advocating these recommendations. Any other major medical association around the world are really in line with these guidelines. And just to show you an example, the use of one of antimicrobials as a growth promoter in cattle, as you can see, they use here they are using tetracycline, and the more tetracycline that you use, the more resistant E. coli that you get on the gastrointestinal tract of these animals. And on this other graph, what you see here is basically the overall use of antimicrobials in different countries throughout the world. All the countries in the world except for Europe, and now US seems to be doing the right thing. But basically, China, Brazil, India, the projections are that they will almost double the use of antimicrobials by the year 2030 as growth promoters. In Europe, they basically officially banned all their use by 2001, and Denmark became kind of an international leader in the fight against antimicrobial resistance. Now they monitor all the sales and the resistant trends in humans and animals. And the funny thing is that by removing the antimicrobials as growth promoters in pigs, they show that there were no negative consequences on farm profits, and they had actually at the beginning they had some increases in post-weaning diarrhea, which requires some interventions such as changing in feeding and some procedures in weaning. But basically, their models show that it's possible to be competitive in the absence of these growth promoters. And in fact, their production has grown up since they removed these growth promoters, and they're doing really well instead of going down. So, how about the regulations in the US? Well, between 2014 and 2016, the FDA implemented a voluntary plan with the industry to phase out the antimicrobials as growth promoters. It didn't seem to work out because the tons of medically important antibiotics for use in food animals continued to increase. So basically, at the start of 2017, all the medically important antimicrobials were no longer approved for growth promotion, and the uses had to be clearly indicated for the therapeutic purposes with veterinary supervision, whether it was to treat animals that exhibited a clinical disease or animals in which morbidity or mortality had exceeded a certain baseline, or for prevention when the risk was too high of becoming sick. And as I said before, the WHO is even recommending not using the critically important antimicrobials for disease treatment and control unless there is a specific susceptibility test that demonstrate that there is no other drug option available. So, what are the critically important antimicrobials? As you can see here, the FDA has a list of the medically important antimicrobials, which are ranked by a group of experts into critically important, highly important, important, or non-medically important. And the last ones are the ones that are obviously still remain to be used as growth promoters. The main category here are probably the ionophores, which are obviously not used for human in human medicine. This FDA list is basically the same one that you have in the classification of the WHO, which is basically based on the relative importance for human medicine. And as you can imagine, here the idea is to preserve those antimicrobials that are considered critically important and use them only as a last line of defense in life-threatening situations. Basically, in a nutshell, when we plan to use any of these antimicrobials, the recommendation is to do so based on susceptibility testing and trying to preserve those that are most important for human medicine. So if we go back to this FDA list, which I would like you to remember, is that the critically important antimicrobials, which are the same as the WHO, are, as you can see here, the fluoroquinolones, the macrolides, and basically the third and fourth generation cephalosporins. So these are really the ones that we should be preserving and probably use them as a last resort, so to speak, when we don't really have any other options, at least for food producing animals. We can also reduce antimicrobials in other type of applications like prophylaxis and metaphylaxis. And we will see specific examples like doing better diagnostics in weaning of piglets that can help us reduce the use of antimicrobials, for example, to treat diarrhea. And we will present on how to, for example, precondition calves before transportation by doing good vaccination and weaning programs so that we don't really need to treat them when they arrive to the feedlot. And finally, it's obvious that we can also reduce the overall use of antimicrobials if we can avoid necessary therapy. And there are basically conditions that we'll address in future videos for dogs and cats that we tend to overuse them. For example, to treat skin conditions or respiratory or urinary tract situations that are totally unnecessary. And finally, preventing and controlling infections is obviously with good management, vaccination, biosecurity. These are obviously the best ways to reduce the overall need of antimicrobials. When we refer to the drug-driven resistance, here we're basically talking about using antimicrobials without any laboratory backup to tell us what the susceptibility of that bacteria is. We really need to start relying on laboratories to tell us what to use instead of doing empirical treatment, especially if we use drugs that are critically important by WHO standards, which I repeat are the fluoroquinolones, macrolides, and third and fourth generation cephalosporins. So this second point basically is highlighting the importance of starting using laboratory to tell us what drugs we should be using and trying to move away from empirical testing, empirical treatment, sorry. On the final point, which has been really a major shift from the way it's been done for decades, is that the latest trend is that the treatment should be avoided after the clinical resolution of symptoms, as the longer the treatment, the greater the chance of developing antimicrobial resistance, at least on the commensal microbiota. As I say, this has really been a major change from the way it used to be. Now the doctor may just simply tell you to stop taking the medication when you feel better and not wait until it was initially prescribed for. So to just wrap up everything, how do we translate everything that we just said into practical guidelines that can be used to our day-to-day practice? Well, obviously, we need to focus on animal species and those and disease-specific recommendations, highlighting the current practices, which may be incorrect, or we may need to do further testing to implement an optimal antimicrobial treatment. So in future videos, we will address the specific conditions that account for the most common antimicrobial use. In pigs, which is diarrhea. In cattle, we'll talk about respiratory and mastitis. For dogs, we'll talk about skin, intestinal, and lower urinary tract disease. So I'll just say bye-bye for now and see you in later videos.